Demi Lovato, Kurt Cobain, and Winston Churchill. What do these three people have in common? They've all been diagnosed with bipolar disorder. It is estimated that over 4% of the American population suffer from this disorder at some point in their lives. Bipolar disorder can be diagnosed in a few different ways, including mood charting, a psychiatric diagnosis, or a physical exam. The diagnosing of bipolar disorder has come a long way in the past few decades. It used to be commonly mistaken for things like schizophrenia, dissociative identity disorder, or even just depression. The most common symptom of bipolar disorder is what most people would refer to as mood swings, between highs, which are referred to as mania, and lows, which is a depression. This can be accompanied by a myriad of symptoms. During mania, someone might exhibit irrational and almost dangerous behavior. This would include things like money spending to the point of no return. Things that normally you wouldn't see them doing that could be considered dangerous or life-threatening, risky behaviors. Like if you have a friend who doesn't like to do certain things like jumping out of airplanes, but then they enter a manic phase, they would be willing to do something like that, even though it might put them at risk. So any kind of risk-taking like that could be exhibited during the manic phase. Then there is the low phase, which is the depression, and it is a very different phase. During the depression phase, you could see someone disassociating from their friends and family, becoming more introspective, not being able to get out of bed, displaying major signs of depression that you might see in someone with just depression versus manic depression. And then it could even go into as far as going into phases of depression that include self-harm and lead to suicide. To diagnose someone with bipolar disorder, a psychiatrist might have somebody do what is called mood charting. So what that involves is basically just tracking every day how you feel, and then you would track symptoms of the mood that you're exhibiting. So for example, on a day like today, I might say that I'm feeling pretty normal. The anxiety is low, and then I would write down how that's affecting my day. And then a psychiatrist would look over a few weeks data of this and be able to diagnose you based on the mood changes and the behavior that accompanies them. Another way that a psychiatrist might diagnose you with bipolar disorder is just to interview you, to sit you down and ask you questions about how you relate to other people, how your relationships are progressing, how close are you with your family members, do you display any signs of the manic phases of bipolar disorder, are you in debt, do you spend money carefree and dangerously, and then are you also displaying signs of being depressed. So a psychiatrist might use both of those things together to determine whether or not you have bipolar disorder. They also could ask you about your genes. If that's bipolar disorder does have a small chance of being hereditary and you gaining those problems from your parents or extended family members. So they might even look at that. Once you have your diagnosis, the most important thing to do is to seek treatment to help alleviate the side effects. It's important to note that you cannot cure bipolar disorder. A mental health problem cannot be cured because it is your brain. We haven't come that far. But you can alleviate the symptoms. You can live a normal life. And There are two main forms of treatment for bipolar disorder, and most of the time you would do both of them, not one or the other. The first one is medication. So the most widely used drug for the treatment of bipolar disorder includes lithium carbonate and valproic acid. The lithium is used to reduce the manic phase, and it may also prevent recurrence of depression, but usually it is more effective against the mania phase of bipolar disorder. And it is often, that's why it's often given in conjunction with other medicines. So you might take one medication to control the manic phase of bipolar disorder and another to control the depressive phase of bipolar disorder. It's a little tricky, and sometimes you have to go through several rounds of medication, trial and error basically, to discover what's going to work best for you. Not every bipolar disorder is the same. There's even several different classifications of bipolar disorder itself. Another common form of treatment includes therapy. So this could be one-on-one therapy, group therapy, psychotherapy, talking to a psychiatrist versus talking to like a behavioral psychologist. Each one of these has its own list of pros and cons, and you have to, again, work and figure out what's best for you, the patient. For me, it's group therapy. I enjoy being in a group and learning from other people how they're dealing with the disorder itself. Treatment is crucial for any kind of illness, but for some reason, there's a huge stigma associated with any kind of mental disorder, especially seeking help for it, which unfortunately means that many people tend to self-medicate and that leads to a lot of misconceptions about what bipolar disorder is. The two main misconceptions that I face every day is that it just means you're moody or unpredictable, and that bipolar disorder can be cured with exercise or losing weight. I hear that a lot. The biggest one, though, I still say would be just being unpredictable or moody, and this is not the case. You can have periods of mania and periods of depression, but also bipolar people also have long periods of balanced moods, and they may experience a mixed phase. So you could experience both at the same time. It doesn't mean that I'm flip-flopping, every couple hours. It just means that I experience moods way harsher and more deeply than someone might, and I have to use coping mechanisms with the anxiety and other symptoms that come along with that. In fact, since I've accepted this diagnosis, my life has become more predictable than before. I'm able to use the treatments and balance that against my life, and I now can understand which mood I'm about to shift into based on symptoms and just mood charting in general. The other misconception, and this can actually be applied to almost all mental health disorders, is that losing weight or exercising is what's going to cure you, and that's just not the case. While getting out and exercising can definitely help, and for some people it's even a huge form of relaxation or medication for them, this doesn't mean that it's going to cure you. Suggesting that someone might cure their cancer by losing weight or exercising is not only not true, but really just insulting to the person. So when you're thinking about that, think about it in a way that a person with cancer is the same as a person with a mental health disorder. We all have disorders. It's not something that just comes and goes and you have to take control of it. It is an actual disease of the brain. I hope that knowing more information about bipolar disorder not only helps you to understand it, but motivates you to do your own research. In order to be better, I really feel like we have to understand each other and what we're going through. And 1 in 5 Americans suffer from a mental disorder, which includes bipolar disorder. If there's anything to be learned here, I think it is that bipolar disorder doesn't have to be the end of any goals or dreams. It is not the end-all be-all of your life or your friends' or family's lives. Obviously, like I mentioned, there's many famous people who suffer with bipolar disorder and are still crushing their dreams and goals. So we just have to end the stigma so that seeking treatment is normal and encouraged. And that is what I want you to know about bipolar disorder, and I hope you enjoyed. Thank you.